Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we're talking about peripheral artery disease. Shiny legs, hidden danger. Have you ever noticed people sunbathing on the beach? They often try to get smooth, shiny, tanned legs. However, if your skin appears shiny, hairless, and changes color without explanation, it's worth consulting a doctor. These could be signs of peripheral artery disease. Peripheral artery disease, or PAD, is precisely what it sounds like, a disease affecting the peripheral arteries. Arteries carry oxygenated blood from the heart all over the body, and the peripheral arteries are those outside of the heart and brain. The exact criteria for what causes this low blood flow isn't always well defined, which makes statistics a little iffy, but somewhere around 6 to 7% of people in America have PAD. This number is higher in African Americans than in other groups, and the risk increases with age. Peripheral artery disease most frequently damages the arteries responsible for supplying oxygen to the legs, which is why symptoms typically manifest in the legs before affecting other areas of the body. Symptoms include intermittent claudication. Claudication from the Latin word for to limp, which is calf cramping pain during exercise. Leg pain at rest. Weak or tired legs, making it difficult to perform daily activities. Skin changes, including shiny, hairless, blue-tinged, cracked, cold, nail changes, and wounds. Slow to heal wounds or ulcers on legs or feet, which can be prone to infection. An inability to exercise, which exacerbates problems by further decreasing blood flow and weakening muscle. These are painful and aggravating, and if left untreated, PAD can have serious consequences. Low blood flow to the limbs can result in the need for amputation. On top of this, PAD is indicative of bigger problems with the cardiovascular system and may present a higher risk for heart attack, stroke, and death. All these complications can make sunbathing less enjoyable. With PAD, low blood flow typically occurs in medium or large vessels. The walls of these vessels may narrow from plaques in a process called atherosclerosis, or they may become blocked by a blood clot called thrombosis. There are a few other potential limiters of blood flow, though the strictest definition of PAD is from atherosclerosis alone. In response to low blood flow to the area, the body tries to compensate by growing new arteries and changing muscle composition, especially in the calves. When the body can't effectively compensate, muscles are reduced, fat increases, and the small blood vessels stop working properly. This can lead to an accumulation of fats, limited waste clearance, and inflammation. Altogether, fats in the skin can leave it shiny. Low blood supply can change the color, and reduced oxygen in hair follicles can cause them to function improperly or die, leaving the skin smooth and hairless. Risks for PAD include age, smoking, diabetes, a history or family history of cardiovascular disease, and high hsCRP, which is an inflammatory biomarker. Conditions that may indicate risk include kidney disease, high cholesterol, and high blood pressure. So what can be done? The first step is diagnosis. The classical symptom of calf cramping pain or intermittent claudication isn't present in a majority of PAD patients. Those at higher risk, such as smokers with type 2 diabetes, may want to take an ankle brachial index or ABI, which is a quick, non-invasive test comparing the blood pressure in the upper arms to the blood pressure in the ankles. If a healthcare provider diagnoses PAD, they can offer several possible solutions. Treatments that help lower the risk of major cardiovascular problems are critical. A doctor may prescribe aspirin or other medications that lower the chance of blood clots, or statins that lower the circulating fats in the blood. Smokers may be encouraged to quit or be prescribed the use of smoking cessation tools. Other medications may be prescribed to target associated conditions like high blood pressure or diabetes, further reducing risks to the cardiovascular system. Several treatments target PAD specifically, including exercise. Supervised structured exercise, including treadmill and resistance training, may reduce pain and increase leg function. It may be as simple as walking on the beach instead of lying in the sun chair to get that tan. Special medications like cilostazol target arterial muscles. In advanced cases of PAD may require revascularization, where arteries are cleared using surgery or other means. Proper footwear may also help, and clinical trials continue to search for new treatments for PAD. These may include therapies that target cells or genes and new ways to revascularize peripheral arteries without surgery. So the next time your legs look like a sunbather's dreams, but your arms don't, consider checking with your doctor and local clinical research center to look for care options. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.